All right, hi Adam, it's Dr. Buford. We're just getting started on your left knee here. Right now we're just flushing the knee out with a bunch of salt water just to clear up the image so we can see. And this is the medial or inside inner compartment. And we can see some of these areas already as we start to look around where you've lost a lot of cartilage off the condyle. The meniscus is down below, and as we look down at the tibia, we can see that you've got some areas of full thickness cartilage loss on the tibia too. That's what these kind of yellowish areas are. So you can see that there. Now we're going to keep working here. Once we get a clear picture, we'll come back up. But we're getting a pretty good picture of the posterior horn of the meniscus on the medial side. That looks pretty good. It's this femoral condyle as we flex it down that is not in great shape right here. I think this is where some of the loose pieces are coming from. We'll keep working to show you some more in a minute. Okay, so we've identified some loose pieces, some bigger ones. Here's one of them. And actually what I need is a grasper, not a biter. So see if they got a grasper there, or even a coker. This will allow me to break it into smaller pieces, but sometimes you can just take it out intact. So there you can see we've got a hold of it. You can kind of get a sense of how big it is. Actually, it might have just come from something like that on the condyle and just gotten bigger over time. We'll show you some more in just a minute. Okay, so now we've gotten that really big piece out, and it was big. We'll measure it and tell you. Let me see right there. Yeah. Keeping in mind that we took off some of it, but it looks like it's about 3 centimeters by what? Start at the end, so 2 centimeters by about 1.5 centimeters at least. And as we look in the central part of the knee, here's the ACL. And now we'll look in the lateral part of the knee. And this lateral meniscus so far looks like it's in pretty good shape. Maybe a little bit of fraying on the inner edge right there, but the other thing that's notable is that the cartilage on this side looks pretty good. So I'm happy with that. Pause, straight basket. Okay, so we're looking now in the patellofemoral compartment, and this looks pretty good too. The patella at the top of the screen looks good. As we follow it down, all the way to the front of the knee, that looks good. So really the damage is on the inside of the knee. We're going to go back and finish up our evaluation of the joint in the medial compartment here. And we're going to take some measurements here. Do you have a probe? Okay, so now we're getting a better look at this defect on the medial femoral condyle. We're going to place our probe in like this. And again, this is an area of full thickness cartilage loss here. We've got something going on back here, but then as we come up a little bit more anterior, we can see this area here. That's about 6 millimeters, assuming the tip of that is 2 now. It's about 6 that way and 2. About the same going in the perpendicular direction. So that's a pretty good indication of the size there. Just for visual confirmation, we'll put in our shaver. So it's about 1, 2, about 3 shaver, well, at least 2 shaver diameters. So that was indicated it was about 8, and at least 8 by 12, really. Okay, so that gives us the measurements we need in case you have to do anything else. So we will finish up here and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.